Well, hey everybody, Dr. Bulow here, and I was just getting ready to leave the office, and my last patient had a question for me. I thought it was a good question, and so I answered her, obviously. And what I wanted to do was to share my answer with you, because you might know someone who is dealing with neck pain, shoulder pain. Maybe it feels like the head feels like the weight of the world is on their shoulders. And I wanted to go over that with you as to why that may be. So let me introduce you to my stick man. Just created my stick man here for you specially. Here we have somebody who's looking in that direction. This is their head, this is their spine, their shoulder and arm and legs. Now, if you look at the spine, you got 24 bones like dominoes stacked on top of each other, and from the front it should be straight. Now from the side, it should actually have bends and curves and twists and turns. Some of that is, actually all of it is normal and natural from the side. The first curve you have is in your neck, and it actually develops out shortly after birth when you're picking your head up. When you're on your stomach and you pick your head up, that curve sets in. So you actually should have a forward sloping curve in your neck. That's a normal, natural thing. The second curve is the one that goes from your shoulders down midway down your back. That's where your ribs are located. You have that in the womb when you're developing. And then next you have the lumbar curve. Don't worry, we'll get back to that neck and shoulder pain in just a second. Lumbar curve is in your belly. Your back bends forward. You do that when you're learning how to crawl. On all fours, the back kind of sags like a saddle on a horse. And then lastly, you have your tailbone. Kind of looks like a tail coming past your hips. That's your sacrum. It's your butt bone. It's the thing you sit on, right? It's part of your pelvis. So here's what happens. These curves are normal, natural things. It creates almost like a springing mechanism for your spine. And here's what happens. Through accidents and injuries, we get these misalignments in our spine. You know, the connective tissue tears loose, our body compensates, it breaks down. But it can happen through either an accident and injury, or you could be looking at your cell phone all day with your head forward, right? Or maybe you sit at a desk all day. Or maybe you drive all day. And what this does to you is it takes your head that should be directly over your shoulders, and it takes that head and it tilts it forward. And when the head goes forward, you lose this curve in your neck. And the curve in your neck becomes straight, or worse yet, it bends the wrong way. Now, your muscles that hold your head up are back here. The muscles in between the shoulder blades and around the shoulder blades, those muscles connect to your skull, and they are trying to pull your head back as best they can. But in the process, they get sore and they get tired, and we start developing trigger points and pain points all around our shoulder blades, in between our mid-back, at the base of our neck, and we say, oh man, it feels like someone's stabbing me with a knife. It feels like my head weighs 1,000,000 pounds. When you have that situation, or this is where I carry my stress, when you have those kind of conversations, you got to realize the weight of your head is about the weight of a bowling ball. And so as it drops forward, you are going to have more pain and tension in between your shoulder blades at the base of your neck. So what do you do about that? You got to stretch these muscles here, because as I have bad posture, these muscles in the front tend to shrink. So we can stand in a doorway and stretch those muscles. We can lie down with a foam roller running up our spine and kind of do a snow angel, right? Kind of stretching the pectoral muscles right here. We can strengthen our shoulders with rowing machines, TheraBand exercises, rehabilitative shoulder exercises, things like that. And we have videos that we're making for all of the above that will be on our website soon. But the one thing that I think really needs to be talked about is this bowling ball of a head needs to come back over your shoulders. A lot of times, because the neck is the weak link, it falls forward whenever there's instability and misalignment in the neck. So you really also need to see a professional to correct the spine. Are there professionals to correct the spine? You bet. Specific, gentle, precise, educated chiropractors. If you need one, let me know. I'll find you one. If you're within the Western Pennsylvania area, I'd love to be yours. It's that simple, man. We just want to help out. So if you know somebody who's dealing with these issues, hopefully this provides value. But that's why a lot of people, they get tons of pain in the base of the neck and the shoulders. Alrighty? We'll see you guys next time. Bye-bye.